Imagine this. The morning sun streams through your window, but the simple act of swinging your legs out of bed feels like a monumental effort. When you stand, you instinctively reach for the nightstand to steady yourself. Later, you approach a staircase not as a simple path, but as a challenge to be conquered, one deliberate, heavy step at a time. You might find yourself pushing off your knees to rise from your favorite armchair, or feel a flicker of panic when you lose your balance for a moment while crossing the living room. For millions of adults over 60, this narrative is not an exaggeration. It is a daily reality. The prevailing belief is that this creeping weakness, this loss of stability, is an unchangeable and inevitable toll of aging. But what if that belief is wrong? What if this decline is not a sentence, but a symptom, a sign of a correctable imbalance within your body? This phenomenon is a classic presentation of sarcopenia, the medical term for age-related muscle loss. It unfolds silently, without the dramatic pain of an injury or the visible swelling of an infection. It quietly steals your strength and independence until one day, the life you once lived feels just out of reach. The good news, supported by a growing body of clinical research and decades of professional experience, is that this process is not only stoppable, but also reversible. The key doesn't lie in grueling gym routines or expensive invasive therapies. It lies in understanding and replenishing 3 specific powerhouse vitamins that your body is likely craving. This comprehensive guide will illuminate why your legs are the first to weaken, introduce you to the 3 essential vitamins that can restore their power, and provide a clear, safe roadmap to reclaim your strength and confidence. The deeper story: why do our legs weaken first? The gradual decline in leg strength after 60 is a complex issue stemming from several interconnected physiological changes. It's not one single cause, but a cascade of events that makes your lower body particularly vulnerable. The nutritional deficit cascade. As we age, our digestive system becomes less efficient. A key factor is the decline in stomach acid production, a condition known as atrophic gastritis, which is common in older adults. This low-acid environment severely impairs the body's ability to cleave vitamin B12 from the protein in food. Furthermore, the intestinal walls become less adept at absorbing all nutrients, including crucial vitamins and minerals. This creates a chronic, low-grade malnutrition even in those who eat a healthy diet. The circulation slowdown. The cardiovascular system also changes. Arteries can become less flexible and blood flow can slow down. Your legs, being the furthest extremity from the heart and containing the largest muscle groups, are profoundly affected. Reduced circulation means less oxygen and fewer nutrients are delivered to the muscle tissue. This leads to a faster buildup of lactic acid during activity, which is why stairs feel so taxing, and a feeling of heavy, leaden legs becomes common. The vicious cycle of inactivity. The connection between activity and strength is obvious, but in aging, it becomes a self-perpetuating cycle. A slight decrease in strength or a fear of falling may lead an individual to walk less, take the elevator, or ask for help with lifting. This reduced demand on the leg muscles signals the body to conserve energy by allowing those muscles to atrophy further. This weakening then reinforces the initial fear and hesitation, leading to even greater inactivity. It's a downward spiral that can accelerate rapidly. The hormonal shift. Aging is accompanied by a natural decline in anabolic, muscle-building hormones. In both men and women, levels of growth hormone and testosterone decrease. These hormones are critical for stimulating muscle protein synthesis, the process of repairing and building muscle tissue. Without their robust presence, the body's ability to maintain, let alone build, muscle mass is significantly compromised. Chronic low-grade inflammation, inflammaging. Scientists now recognize a state called inflammaging, where the body exists in a state of chronic, low-level inflammation. This systemic inflammation releases cytokines, which are signaling molecules that can accelerate the breakdown of muscle tissue and interfere with its regeneration. Understanding these underlying factors is crucial because it reveals that the solution must be multifaceted, starting with the most fundamental building blocks: vitamins. 1. Vitamin D3, the foundational master switch for muscle and bone. Vitamin D3 is often called the sunshine vitamin, but its role extends far beyond what that cheerful nickname implies. It functions less like a simple vitamin and more like a powerful steroid hormone, acting as a master switch that regulates the function of your entire skeletal and muscular system. After 60, our ability to synthesize D3 from sunlight plummets due to thinner skin and less efficient organ conversion, making supplementation critically important. Why it's so critical? Bone architecture. Vitamin D3 is the gatekeeper for calcium absorption. Without adequate D3, your body cannot absorb the calcium from your diet, no matter how much you consume. It will instead pull calcium from your bones, leaving them porous and brittle, osteoporosis, which dramatically increases fracture risk from a fall. Direct muscle activation. Muscle cells are dotted with vitamin D receptors, VDRs. When vitamin D3 binds to these receptors, it directly stimulates the growth of new muscle fibers and enhances the efficiency of muscle contractions. A deficiency means these receptors are dormant, leading to weak, unresponsive muscles. Neuromuscular coordination and balance. Your sense of balance depends on rapid communication between your nerves and muscles. Vitamin D3 is essential for this process, improving your body's ability to react quickly and prevent a stumble from turning into a fall. Signs of deficiency, often mistaken for aging. A deep, aching pain in your bones, particularly in the lower back, hips, and legs. Pervasive muscle weakness that makes climbing stairs or getting out of a chair difficult. Unexplained fatigue and a general sense of malaise. Increased frequency of falls or feeling unsteady on your feet. Subtle mood changes, including feelings of depression or anxiety. The scientific proof. A landmark study at the University of Birmingham gave seniors 800 IU of vitamin D3 daily. In just 5 days, their leg strength increased by an impressive 19%. Research from Harvard University's Geriatric Center established a stark warning. Older adults with low D3 levels were 40% more likely to suffer a fall or require hospitalization compared to those with sufficient levels. Recommended dosage and smart use. General maintenance, over 60, 800, 1,000 IU international units per day. For those with known deficiency, frailty, or a history of falls, 1,500, 2,000 IU per day is often recommended, but this should be done under medical guidance. How to take D3 is fat-soluble. For maximum absorption, take it in the morning with a meal that contains healthy fats, such as eggs, full-fat yogurt, avocado, or a drizzle of olive oil. 2. Vitamin B12, the nerve insulation vitamin for balance and coordination. If D3 builds the muscular framework, vitamin B12 ensures it runs correctly. Think of your nervous system as the body's electrical wiring and B12 as the essential insulation, the myelin sheath, that coats these wires. Without proper insulation, signals from the brain to the muscles become slow, erratic, or lost altogether. This short-circuiting often manifests first in the longest nerves, those that travel down to your feet and legs. Why it's so critical? The B12 absorption process is uniquely fragile in seniors due to the required presence of stomach acid and a protein called intrinsic factor, both of which decline with age. This makes deficiency incredibly common. Signs of deficiency. The neurological red flags. A persistent tingling, numbness, or pins and needles sensation in your hands or feet. A sense of weakness or uncoordination in the legs, a feeling that your legs aren't quite obeying your commands. Significant issues with balance, leading to a wide-based or unsteady gait. Cognitive symptoms like memory lapses, confusion, or brain fog that are often incorrectly attributed to dementia. A smooth, sore tongue or unexplained fatigue. The scientific proof. A pivotal study from Oxford University found a direct link. Seniors with low B12 levels walked significantly slower, had demonstrably worse balance, and were more than twice as likely to fall within a year. A clinical trial published in the Journal of Gerontology demonstrated that an 8-week course of B12 supplementation in seniors led to measurable improvements in lower body strength, faster reaction times, and a reduction in reported numbness and instability. Recommended dosage and smart use. Effective dose for seniors, 500, 1,000 mcg, micrograms per day. Choose the right form. Opt for methylcobalamin. This is the active form of B12 that the body can use immediately, bypassing the inefficient conversion process that many seniors struggle with. How to take. Since B12 absorption can be impaired in the stomach, sublingual, under-the-tongue tablets, sprays, or chewables are highly effective. Take it in the morning or around midday. Vitamin B1, thiamine. The cellular spark plug for muscle energy. You can have strong muscles and perfectly wired nerves, but without fuel, nothing moves. Vitamin B1 or thiamine is that fuel. It is the essential spark plug in the engine of your cells, playing an indispensable role in converting carbohydrates from your diet into ATP, adenosine triphosphate, the universal energy currency of the body. Every single muscle contraction, from a blink to a step, is powered by ATP. Why it's so critical? The body doesn't store much thiamine, so a steady supply is needed. Many seniors are at high risk for deficiency due to diets high in processed foods, which are stripped of B1, and the use of common medications like diuretics, water pills, for blood pressure, which flush water-soluble vitamins like thiamine from the body. Signs of deficiency: the energy crisis, overwhelming leg fatigue and heaviness, even after light activity, frequent muscle cramps, particularly in the calves, a dragging sensation when walking, shortness of breath, especially when exerting yourself, mental fatigue, apathy, and a lack of motivation. The scientific proof. A telling study from Tokyo University found that over a third of elderly participants had suboptimal thiamine levels, and this directly correlated with reduced leg strength and slower mobility. Research in the Neurological Sciences Journal gave patients with chronic leg fatigue 100 milliliters of thiamine daily. Within just 1 week, an astonishing 82% reported improved endurance, and 68% felt less heaviness and pain in their legs. Recommended dosage and smart use. Therapeutic dose for seniors. While the RDA is low, for restoring energy in those with fatigue or on depleting medications, 50-100 milligrams per day is a safe and effective therapeutic dose. How to take. Take it in the morning with breakfast to fuel your day. Your guide to safe and smart supplementation. To harness the power of this vitamin trio, it's not just about taking them, but about taking them intelligently. Create a synergistic schedule. With breakfast, take your vitamin D3 with fat and vitamin B1 to start your energy for the day. With lunch, take your vitamin B12 to avoid any potential interference with sleep. Quality matters. Not all supplements are created equal. Look for brands that have been third-party tested by organizations like USP or NSF. This ensures that what's on the label is what's in the bottle. Consult your doctor. This step is non-negotiable. Before beginning any new supplement regimen, discuss it with your doctor or pharmacist. They can check for potential interactions with your current medications and recommend blood tests to establish a baseline for your D3 and B12 levels. Embrace a food-first philosophy. Supplements are meant to supplement, not replace, a healthy diet. Focus on a diet rich in whole foods, colorful vegetables, lean proteins, healthy fats, and whole grains. This provides the full spectrum of nutrients your body needs to thrive. Conclusion. Your first step towards renewed vitality. If you have been feeling the encroaching weakness in your legs, it is time to discard the notion that it is simply old age. It is a physiological signal, a request from your body for the essential tools it needs to function. The weakness, the instability, the fatigue, these are not your destiny. By understanding the critical roles of vitamin D3 for structure, vitamin B12 for control, and vitamin B1 for energy, you are now armed with the knowledge to take decisive action. This isn't just about making your legs stronger, it's about restoring your freedom. It's about climbing stairs with confidence, playing with your grandchildren without fear, and walking through life with a firm, steady, and powerful stride. Take this knowledge and take that first, crucial step. Talk to your doctor, evaluate your diet, and consider a targeted, intelligent supplementation plan. This is your opportunity to rewrite your aging story from one of decline to one of renewed strength and enduring vitality.